Most babies are born healthy, but everyone, regardless of age or family and medical history, has a chance of having a baby with some kind of mental or physical condition. Sometimes we can detect these during pregnancy. British Columbia's prenatal genetic screening program offers screening during the early stages of pregnancy that tells you the chance of your baby having Down syndrome, Trisomy 18, or an open neural tube defect. Screening is your choice and is offered free of charge in BC. What does prenatal genetic screening do for me?
All pregnant women have a small chance of having a baby with Down syndrome, Trisomy 18, or neural tube defect. Prenatal screening can tell you if the chance of your baby having one of these conditions is increased. Most women who have prenatal screening will be told that their baby has a very low risk. We call that having a negative screen. Having a negative screen is 99.9% accurate. That means that if you have a negative screen, the chance that your baby will have one of these conditions is less than 1 in 1,000. For approximately 5% of women, the screen will show an increased chance of having one of these conditions. We call that a positive screen. It does not mean that the baby has the condition. It means that the chance is increased. In this situation, diagnostic testing is available to determine for sure if the baby is affected or not. The diagnostic test for a pregnancy that has an increased chance of Down syndrome or Trisomy 18 is an amniocentesis. When the screen shows an increased chance of open neural tube defect, the diagnostic test is a detailed ultrasound. Your healthcare provider can help you decide whether or not to have screening, but ultimately, the decision is up to you.
Tell me about Down syndrome.
Down syndrome is a common genetic condition. Approximately 1 out of 700 babies has Down syndrome. We call it a genetic condition because it's caused by having an extra chromosome 21. Babies with Down syndrome have 3 copies of chromosome 21 instead of 2. Because of this extra chromosome 21, babies with Down syndrome have mild to moderate intellectual disabilities and are at increased risk of certain medical conditions, such as having a heart defect or needing to wear glasses to correct vision. One cannot predict if the medical conditions will be mild or more severe. Adults with Down syndrome live into their 50s. Everyone has a chance of having a baby with Down syndrome, but studies have shown that that chance increases with mother's age. If you want to have more information about Down syndrome, you can visit our website or talk to your healthcare provider.
Tell me about Trisomy 18.
Trisomy 18 is a condition that is much less common than Down syndrome. Only about 1 baby in 6,000 is born with this condition. Like Down syndrome, Trisomy 18 is due to having an extra chromosome, but in this case, the babies have 3 chromosome 18. The chance of having a baby with Trisomy 18 increases with the mother's age. Now, most pregnancies with this condition will be miscarried, but some will go to term. Babies with this condition are born with very severe malformation. Commonly, it affects their heart or it affects how their brain functions. They are weak and they don't grow well, and most babies with this condition will die within a few weeks of being born. Very few will celebrate their first birthday, and all of them will show very severe developmental delay.
Tell me about open neural tube defects.
A neural tube defect is a condition that affects 1 in 1,000 babies. The chance of having this condition does not change with the mother's age. A neural tube defect is a malformation of either the brain or the spinal cord. If it's the spinal cord who did not form properly, we call it spina bifida. And this results in physical disabilities and in some children, intellectual disabilities. Life expectancy will depend on how serious the condition is. Now, when the neural tube defect affects the brain, we call it anencephaly. This is a very severe malformation, and these babies are either stillborn or will die shortly after birth.
What happens during prenatal screening?
If you choose to have prenatal screening and present for prenatal care early in your pregnancy, your healthcare provider will arrange for you to have 2 blood tests. These blood tests can be drawn in any laboratory across BC. Now, if you have an increased chance of having a baby with Down syndrome or trisomy 18, or if you're expecting more than 1 baby, you may also have a special ultrasound called a nuchal translucency ultrasound, or NT-ultrasound. This ultrasound must be done by someone who's been trained and certified, and is only available in a limited number of centers around the province. Now, I'd like to point out that having only the blood tests provides a very good screen for these conditions. NT provides additional information for women who have an increased chance of Down syndrome or trisomy 18. The blood tests and the NT ultrasound are entirely safe for you and your baby and can be done with very minimal discomfort. Results of the screen will be available approximately 10 days after you've had the second blood test.
When does screening happen?
The timing of the blood tests is very important. The first blood test is done just after 10 weeks and before 14 weeks. And the second blood test is done just after 15 weeks and before 21 weeks. If you miss the first blood test, you can still have the second blood test, and it will provide you a good screen for Down syndrome, trisomy 18, and neural tube defect. Doing both blood tests increases the accuracy of the screen result. The nuchal translucency ultrasound is done between 11 and 14 weeks.
What are my chances of having a baby with one of these conditions?
2 to 3% of babies are born with a physical condition which is diagnosed at birth. This 2 to 3% includes a wide variety of conditions. Some can be life-threatening, like having a serious heart defect. Some are treatable, like having a cleft lip. And some are really trivial, like having an extra toe. Prenatally, we cannot diagnose all physical conditions. All women have a chance of having a baby with Down syndrome, trisomy 18, and neural tube defect. While some couples may have an increased chance, these conditions are not usually inherited. They occur by chance. 1 baby out of 700 is born with Down syndrome, and 1 in 6,000 with trisomy 18. The chance of Down syndrome and trisomy 18 does increase with mother's age. 1 baby in 1,000 is born with a neural tube defect. This chance does not change with mother's age. But remember, most babies are born healthy.
Is prenatal screening the right choice for me?
Whether or not to have prenatal screening is a very personal decision. Some women do choose screening because they want to know if their baby has an increased chance of one of these conditions. And by and large, they're prepared to have diagnostic testing, which will give them the definite answer.
My name is Mary, and I have 3 wonderful daughters that came into our life when I was 34, 36, and 38 years old. And during each of the pregnancies, we felt it was important to have information that allowed us to understand the situation.
I was 30 years old with my first pregnancy, and it was a difficult first trimester. There were a few complications. So my husband and I opted to go for prenatal screening to get some more information about how the baby was developing.
For the first 2 children, we decided with the results of the test that the risk was low enough that we were comfortable and felt that we could really enjoy the pregnancies with the assurance that we were making the right choices and doing the right things to prepare for our children. However, in the case of our 3rd daughter, Kate, there was a higher risk rating that we received, and as a result, we decided for a couple of reasons to proceed with an amnio test. The concern that we had, or how we were feeling, was that with 2 young children at home and a possibility of having a complicated 3rd child, we wanted to be prepared for that. We wanted to have that information. And so we proceeded to have the amnio test done. We got the results from that, and fortunately, we have 3 healthy little girls.
The process itself was quite comfortable. and we found it to be reassuring. We got a lot of good information out of it. And looking back on the pregnancy, if I could do it all again, I would again choose to go for prenatal screening.
Some women choose not to have screening. For some of these women, it's because they're concerned about the possibility of having a positive screen, which would bring them a lot of worry. For other women, it's because they know they would not have the diagnostic test because of the risks associated with amniocentesis. And for other women, it's because they know that they would not change anything about the pregnancy regardless of the screen result.
I'm 28 years old and 36.5 weeks pregnant. I chose not to have the prenatal screening test. My husband and I decided this because we, under no circumstance, would terminate the pregnancy. And we thought that any result that we get back that would be positive would add stress to the pregnancy. And we just wanted to enjoy this time as a beautiful and amazing part of our lives.
But ultimately, the decision is up to you.
Is the prenatal screening process the same for everybody?
Prenatal screening varies somewhat depending on what stage you are in your pregnancy when you first present for prenatal care. It also depends on whether or not you're having twins or triplets. Finally, it depends whether or not your chance of having a baby with Down syndrome or trisomy 18 is increased because of your age or your personal or family history. Talk to your healthcare provider. He or she will be able to tell you which option is available to you should you desire screening.
If I am less than 14 weeks pregnant, what is my prenatal screening option?
For women under 14 weeks, 2 blood tests will be taken. The first blood test is taken just after 10 weeks and before 14 weeks. The second blood test is taken just after 15 weeks and before 21 weeks. The combination of these 2 blood tests is called Serum Integrated Prenatal Screening, or SIPS. For women who have an increased chance of having a baby with Down syndrome or trisomy 18, a nuchal translucency ultrasound may be added. This is done between 11 and 14 weeks. The combination of the 2 blood tests and the nuchal translucency ultrasound is called Integrated Prenatal Screening, or IPS.
If I am over 14 weeks, what is my prenatal screening option?
You can still have a single blood test drawn between 15 and just before 21 weeks. This single blood test is called the quad screen.
I'm over 35. Are there any other options for me?
If you are over the age of 35, you have an increased chance of having a baby with Down syndrome or trisomy 18. In addition to the 2 blood tests, you may be offered a nuchal translucency ultrasound. These special ultrasounds are done in a limited number of centers in the province. Adding the nuchal translucency ultrasound to the blood test reduces the chance of having a false positive screen result. However, doing only the blood tests has a very high detection rate of Down syndrome and trisomy 18, so it is a very good screening option. If you are 40 years or older at the time of delivery, you will also have the option of going directly to a diagnostic test such as CVS or amniocentesis without prior screening.
I have a personal or family history of one of these conditions or other health conditions. What can I do?
If you've had a previous child with Down syndrome, trisomy 18, or neural tube defect, or if you or your partner was born with a spina bifida, you do have an increased chance of having an affected child. Discuss this with your healthcare provider. He or she may suggest that you be seen by a genetic counselor who would review your history, discuss your chance of having an affected child, and review your screening and diagnostic options. Also, if you are known to have an increased chance of having a baby with a neural tube defect, it is recommended that you use higher doses of folic acid supplementation prior to conception. Discuss this with your healthcare provider.
I'm pregnant with twins. What are my options?
Depending on your age and how far along you are in your pregnancy, you have different screening options to consider. If you are less than 14 weeks and you are carrying twins or triplets, if NT is available, that is the best screening option for you. If NT is not available, you will be offered the 2 blood tests. If you are greater than 14 weeks, when you find out that you are carrying twins, the 2nd blood test will be offered to you. If you are 35 to 39 and NT is not available, you will have the option of an amniocentesis without prior screening. If you are carrying triplets or more, talk to your healthcare provider to review your screening options.
But I want to know for sure. Why can't I only have a diagnostic test?
To know for sure, you would need to have either a CVS or amniocentesis and chromosome analysis. Both procedures are associated with the risk of losing the pregnancy, and the testing is expensive. These tests cannot be offered to women who have a low chance of having an affected child.
My screen showed an increased chance for Down syndrome. What now?
The first thing to remember when you receive a screen with a positive result is that the vast majority of women who receive a positive screen have normal babies. If your risk comes back at 1 in 100, remember that 100 women with the same risk, only 1 of them will actually have a baby with Down syndrome, the other 99 will not. Understanding how you feel about those numbers will help you make a decision as to whether or not you'd like to have the diagnostic test, which is amniocentesis. And amniocentesis is done about between 15 and 22 weeks. And your results from the amniocentesis will come back in about 2 to 3 weeks.
My screen showed an increased chance for Trisomy 18. What now?
The most important thing to remember when you receive a positive screen for Trisomy 18 is that this condition is quite rare, and the vast majority of women who have a positive screen actually have normal babies. If your risk is 1 in 200 for having a baby with Trisomy 18, only 1 out of 200 women will actually have a baby with this condition. The other 199 will not. So you will be offered an amniocentesis within a week of receiving this result. If you can't decide whether or not to have an amniocentesis, some women have an ultrasound first. Babies with Trisomy 18 often have abnormalities that can easily be seen on ultrasound, and this might help you decide whether or not you'd like that diagnostic test. If you receive a positive screen for Trisomy 18, you will probably be sent to Vancouver, Victoria to see a maternal fetal medicine doctor or a genetic counselor who will talk to you about the details of Trisomy 18 and help you decide whether or not you'd like to have an amniocentesis. If you have an amniocentesis, your results will come back within 2 to 3 weeks. It can be quite stressful waiting for your results, so having a support team around you can be very helpful.
My screen showed an increased chance for an open neural tube defect. What now?
If your screen is positive for an open neural tube defect, you'll be offered a detailed ultrasound. The vast majority of these open neural tube defects can be seen on ultrasound. You'll also be offered an appointment with a maternal fetal medicine doctor or a genetic counselor, and they'll explain what an open neural tube defect might mean for your baby. You may also be offered an amniocentesis depending on the results of the ultrasound.
What is amniocentesis?
An amniocentesis is a test that pregnant women typically have done anytime after 15 weeks of pregnancy. It's typically used to diagnose a condition like Down syndrome or Trisomy 18. A needle is inserted through the mom's abdomen into the amniotic fluid around the baby. A small sample of this fluid is obtained and sent to the lab, and it typically takes 2 to 3 weeks to get the results back. During the entire procedure, we watch what we're doing under ultrasound, and by doing so, there's no risk of the needle hurting or harming the baby. There is, however, a small risk of miscarriage associated with the procedure, so unlike a blood test or an ultrasound, it does carry a small risk associated with it. If we did the procedure on 200 women, 1 would have a miscarriage directly as a result of the test.
What is a detailed ultrasound?
An ultrasound uses harmless sound waves to determine how well your baby is growing and developing. A detailed ultrasound is typically done between 18 and 20 weeks of pregnancy, and what we do is we look at your baby from head to toe to make sure that all the organs are growing and developing the way they should. Examples: how the heart looks and how the brain looks, and so on. It can also be used to diagnose birth defects like an open neural tube defect. We also look for certain clues on the ultrasound that may increase your risk of having a baby with a condition like Down syndrome.
What if my baby has one of these conditions?
Your healthcare provider will let you know whether or not the diagnostic test has confirmed your baby has Down syndrome, Trisomy 18, or an open neural tube defect. If your baby does have one of these conditions, you'll be offered the opportunity to come talk to a genetic counselor about what your options are. Making a decision about your pregnancy can be quite difficult. Some women choose to end the pregnancy, some women just like the information so they can prepare for having a baby with special needs, and some women decide to put their babies up for adoption. Your healthcare provider, your genetic counselor, and your family will help you make a decision about what's right for you in your pregnancy.
My name is Mary, and I have 3 wonderful little girls that arrived in our life when I was 34, 36, and 38 years old. And during each of the pregnancies, we felt it was important to have information that allowed us to understand the situation that we were coming into. And as a result, when we were offered the choice of prenatal screening, we decided in all 3 cases to take it. We felt that was the right thing to do, as it would give us some initial indicators, but in a way that was not invasive to the baby.
I chose not to have the prenatal screening test. My husband and I decided this because we, under no circumstance, would terminate the pregnancy, and we thought that any result that we get back that would be positive would add stress to the pregnancy, and we just wanted to enjoy this time as a beautiful and amazing part of our lives.
For more information about prenatal screening, talk to your healthcare provider or visit www.bcprenatalscreening.ca.